In tonight's Health Edge, it's a virus commonly found among daycare-aged children. But right now, hand, foot, and mouth disease is in the headlines because of an outbreak at a college in Florida.
We want to bring in our chief health editor, Dr. Nandi. And Doc, how contagious is this? I mean, when you think of this, I think farm animals, that kind of thing.
Right, and I have little kids, so I know this is pretty contagious. It's that time of year as we head into fall when hand, foot, and mouth disease starts to spread more rapidly. It's very contagious, to answer your question, and you catch it when tiny air droplets are released, when a sick person blows their nose, coughs, or sneezes. Typically, young kids like mine are the ones most likely to get it, but older children and adults can also become infected, just like we're seeing at the college in Florida. It's commonly caused by a virus called Coxsackie virus A16. So,
glad I didn't have to say that. All right, why does it affect mostly infants and younger children?
It's an important question. So kids younger than 5 years of age don't have the immunity that we do, and the decreased immunity to protection for viruses that causes hand, foot, and mouth disease, or HFMD. Now, once you get it, you'll develop an immunity, but since this disease is caused by different viruses, you can actually get it again, and adults can pass it along the virus without showing any signs of even having it.
So, is it serious? I mean, how do you know you have it?
Yeah, so it's typically not serious, but hand, foot, and mouth disease is the symptoms that you can experience are painful red, blister-like mouth sores that often start as flat red spots. You can get red rash on hands and feet, fever, reduced or loss of appetite, sore throat, and to avoid or prevent HFMD or hand, foot, and mouth disease, here are my prescriptions. So number one, we talk about all the time, right? Wash hands often, use soap and water, folks, and scrub for 20 seconds. Number two, avoid touching your eyes, your mouth, your nose. Unwashed or contaminated hands can really transmit the illness very effectively. Disinfect frequently touched surfaces, especially if an outbreak has happened or someone's sick, such as in a daycare center. Now, teach good hygiene practices to your kids early. Explain why they should wash their hands often and keep fingers out of their mouths.
Any way to treat this?
So, usually it's because it's not very serious, you shouldn't, but there's no treatment traditionally for hand, foot, and mouth disease except for comfort measures and hydration. But make sure that your kids or you drink enough fluids and either take acetaminophen or ibuprofen for fever or pain when you have it. But typically it goes away by itself and it's not a problem, but you got to watch them for any signs. Rarely you can get encephalitis or brain inflammation or meningitis, but it's rare. So just watch your kids and most times it should be fine.
So does the foot part mean you can see those blisters on your feet?
You can.
Oh, okay.
You can, but it does go away.
Thank you, Doc.
Of course.
If you have a question or a health concern for the good doctor, you can email him at drnandi@WXYZ.com or send it to us, Facebook, Twitter. We'll get it right to him.